Well, good afternoon, everyone, and welcome back to the Wilkes Wednesday Webinars. This week, we are very excited to have the acumen and grace of a good fellow alumni, Tony DeRay, who will be presenting the subject matter of telemedicine. I want you to know that if you would like to ask questions or you have information that you'd like to share, please take advantage of the Q&A buttons or the chat feature, which is at the bottom of your screen. And I would also encourage you to keep up with the Alumni Association website and Facebook page, where we will introduce additional topics as the semester continues, items of interest that you have expressed interest in. And I would also like to encourage you to reach out to us if there's subject matter which you'd like to learn more about, whether it's specific to your professional or personal development, or it's specific to things about being an alumni of Wilkes University. Now, let me tell you a little bit about Tony. You see his, a brief synopsis of Tony here on the screen, but you should know that Tony has been an outstanding friend to the Wilkes University alumni community and to your alma mater. Tony is very supportive of so many things. He's very supportive of his beloved football team, of athletics at Wilkes, where he acts as a major sponsor through BSI of our annual golf tournament. Keep your eyes and ears open. We are determined to host another golf tournament this summer. One way or another, we are hoping to get some normalcy back in all of our lives. Tony's also supportive of our first generation scholarship fund, which is so vital to the lives of so many of our students. It is still the case that nearly 50% of our students self-identify as being the first in their families to go to college. So without further ado, I would like to introduce Tony to our group, and I know he has some vital information to share, and he's joined by some associates from BSI.
Thanks, Margaret. How are you?
I am well. How are you?
I'm good. I'm good. Thanks for having me.
Oh my goodness.
I appreciate any opportunity to leave my house after the last 72 hours is welcomed.
I know. How about this snow? I hope everyone's staying safe, but boy, oh boy. And if you need telemedicine advice, on your back or something like that, after all the shoveling we're having to face, you've come to the right place.
I just actually got an email from one of our wellness vendors about 750 to 1,000 calories an hour of shoveling. So,
wow. Well, I guess I better get shoveling.
Lift with your legs.
There you go.
All right. So do you want me to share my screen here, and
Sure, that would be great. And I'm gonna check out, and I'll listen. I'll poke my head in if we need any additional help or there are questions.
Okay. All right, Margaret, you see that okay?
Yes, I see it just fine.
Okay, everyone. So we'll have a little fun here. I mean, at telemedicine, happy to cover it certainly, and we'll talk a little bit about how BSI fits into that for our clients across the country. I was available for two things. Maybe telemedicine. I thought maybe this would be us coming together to sign a petition to bring back winter weekends. But since that's not currently on the administration's table, I guess we'll stick with telemedicine today. Certainly any questions, type them in. We've, as a firm, we've been doing webinars since the beginning of COVID last year. And just a couple of slides here, won't be too heavy, just to give a little bit of information. The thought process here for, any of the guests would be, you're either one of two buckets. You're either in the bucket that you have an employer that most likely offers telemedicine. So we could talk just a little bit high level. The idea, the takeaway would be the encouraged to reach out and use it. We do find that it's an underutilized benefit for companies that we go to work for, or potentially you're a decision maker for an organization or a company. And there's some real financial positives to organizations from implementing telemedicine successful. So real quick, a little bit about BSI, a company I founded in 2003 in Detroit, Michigan, obviously going to Wilkes, born and raised in the Bloomsburg area in Pennsylvania. I found my way out to Michigan and worked for a big healthcare company. I actually worked for Geisinger in Wilkes-Barre when I went to school. So that was kind of the start of my career in healthcare. We're an independent employee benefits consulting firm, so we're essentially the middleman. We work for the companies and their employees negotiating with the insurance carriers. So if you have an employer, most likely you're offered benefits, including health insurance, dental, et cetera. And we're the ones that are negotiating with the insurance carriers on behalf of the companies that we represent. This is our mission statement. We're advocates for our clients on both the human and financial level. We have a fully staffed customer service department. So obviously, you know, with healthcare, certainly it's very expensive, costs a lot of money, costs companies a lot of money, but it's also a very human experience. So on the individual member level, very challenging to deal with our healthcare system across the country. It's very fragmented. And certainly if you didn't know that pre-COVID with the vaccine rollout, certainly it's become very apparent, supply chain and how broken up across our country it is, where you look at the inequity of vaccines being available in some areas and completely scarce in others. So that's our role for our company. Just a little bit more here about the organization. So again, I founded in 2003. We have clients across the country, 41 states at this point. We have offices here where I'm at today in Bethlehem, Pennsylvania is our headquarters, also in Detroit in the Wilkes-Barre area with our satellite office. We are approaching about $500 million in employee benefit spend that we manage as an organization. This will just give you a snapshot of some of the logos that we represent. Obviously, this one, if you can see my cursor, is one that we're extremely proud of. We've represented all 400 of the Wilkes University employees for a number of years now. So obviously, a great pleasure. I'm glad that they didn't require my transcripts from Wilkes in order for us to compete for the business years ago. But it is a really true honor for us to represent to Wilkes and represent the employees. It's a great way for not just me, but my entire team at BSI. We have about 30 employees to be involved with, you know, obviously an organization like Wilkes that's so close to me. Just a little bit about the firm. We have been, I guess I'll just go to the right there. We've been named the fastest growing company here in the Lehigh Valley for the last 7 years, top consulting firm. Last year, we were named to the Inc. 5000 as one of the fastest growing companies in the country. So a great honor for us and our employees over the last year. So just to jump a little bit into the telemedicine piece, I know Garth Jones, I see there. I want to just thank Garth for some great conversation. I've known Garth for years and, you know, obviously through the football alumni. Had no idea that Garth founded telemedicine, you know, back in 30 years ago when it certainly wasn't even on my radar screen. But it was great to have that conversation, Garth, and learn a little bit of the detailed history of telemedicine. It really does go back 20, 30 years. We could talk a little bit about that, but Garth, I appreciate that. And, you know, at any point, maybe when I'm finished up, if you would jump on and give some color, since you've lived this for so long, it's relatively new, maybe last 10 years for me and for our team at BSI. So just a little bit of a background on telemedicine, you know, from an overview perspective. You know, just to won't read through all of this here, but just kind of to get a general overview of telemedicine. Certainly in the last year, it's become so popular, but it has been around for quite some time, and it's evolved over the last 20, 30 years in being more accepted, right? So, and I think that's the most important thing that we've seen from a telemedicine perspective. It's the way of the future. It's been projected, you know, for years to be, you know, obviously popular, but there was resistance from individuals in wanting to use it. Am I really going to have a doctor's appointment via phone? And then also resistance from the actual healthcare systems themselves, from doctors, from hospitals. Some of that is financial, some of it is other, you know, worrying about money, you know, flowing out of hospital systems and into, you know, the telemedicine. But certainly it's here, it's not going anywhere. COVID's put its stamp on that. And certainly from a generational perspective with technology, certainly the younger, the age bracket, and as, you know, kids mature into young adults and then into full-fledged adults, they're super comfortable and actually prefer getting medicine delivered via the telemedicine model. It's not for every ailment, of course. It's certainly not to treat, you know, true emergencies. You break a leg or an arm, that's telemedicine isn't going to fix it yet. But certainly, I'm sure Garth could add to that later. You know, we're rapidly headed with 5G and some other amazing advances in technology, and it's already happening where surgeries are being performed remote. Just some amazing things that are in general happening, not in person. But in general, obviously, telemedicine has grown quite a bit. When you think about traditional delivery models, you know, emergency rooms open 24/7 for the most part, but not primary care physicians, not specialist visits. So when you think about different ways that you can use telemedicine in a 24/7 environment, there are huge benefits, not to mention, you know, the idea that we don't have to travel, you know, to have these services. Again, just a little bit of the history here, just so you can see. So it's not a completely new phenomenon. You know, obviously telemedicine, and this is really, again, the conversation that I had with Garth, is he's a great historian because he's lived this over the last 30 years. You know, the reality of telemedicine becoming something that you can do over a phone. I mean, obviously the technology had to increase before we get comfortable seeing doctors. The actual technology sitting behind what makes telemedicine so effective, you know, obviously had to progress the way it has over the last 20 years. So it's certainly not new, but it's rapidly growing. And certainly in the last year, the acceleration has been enormous. These are just a little bit of the stats to give you an idea of the last year. So primary care doctors visits down 60% in April 2020. Capital Blue Cross, one of the Blue Cross organizations that we deal with here in Pennsylvania, their app increased almost 300% the use of it. You see there mental health. This is a big piece of telemedicine that has really been the fastest growing, you know, by far. You can see 439%. Huge impact on mental health that the pandemic has had. And telemedicine obviously has been a lifeline for individuals to be able to seek care through the telemedicine. It's more affordable and it's certainly more accessible for the masses to be able to talk one-on-one with a therapist. So the news obviously is that telemedicine market is growing considerably. 20%, you know, compound annual growth is what's projected there. You'll see in the last bullet. From a BSI perspective, we've embraced telemedicine 7-8 years ago as something that we knew was going to be more and more integrated with the groups and their healthcare that we represent. And there, again, like I said, there's a huge financial component to this for companies that very, very rarely do we have win-wins in the idea of the employees getting a benefit that they really love once they come to use it, and it actually saves the employer money. And telemedicine is the mixture of both of those things. Anytime that you can get somebody obviously to use telemedicine for a non-emergency situation, because up to 75% of all emergency room visits are non-emergent. Keeping people out of the ER, the most expensive place to deliver care. It's no fun to wait 3 hours in an emergency room for care, and certainly it's not efficient or cost effective. So the continued rise with technology and now acceptance, you're just going to continue to see telemedicine take off and cover more and more types of services. So just a little bit more about the landscape here. I mean, you can clearly see Americans have access to the technology that will help them access telemedicine. And then you can see some of those other bullets as these younger generations going to mature and start to enter workforces. And they are much more comfortable, obviously, using and actually, again, like I said, prefer telemedicine. All right, so some of the benefits, like what do you use telemedicine for? What obviously is not for? So these are some of the most popular things that we see from a client perspective, it being used in mass. So you can see flu, pink eye, sinus problems, UTIs, bronchitis, allergies, nasal congestion. So all of these things people end up hitting the ER for without effective telemedicine. And telemedicine has become so effective. We'll talk a little bit about the way that BSI likes to implement, because it is important, we think, not just having telemedicine offered to employer groups and their employees, but how in which you go about doing it. But you can see some of the bullets here on, you know, the benefits: increased flexibility, reduced costs, saves time. Really important thing about telemedicine, if done correctly, board certified physicians in the state that you're actually calling from. And the reason that they want to really do that, and that's why it's most effective, is because those doctors can write prescriptions, non-narcotic. But if you look at all of these issues on the bottom of the screen here, all of these things can track back to getting prescriptions for prescription drugs that can take care of these types of ailments in a rather quick way. So it is important to have that ability to be able to call through telemedicine, have the prescription sent directly to the pharmacy, and really that process can take no longer than 30 minutes from start to finish, where you're actually at a pharmacy picking up a medication. So just a couple more, overall advantages here. Again, the convenience. Once you get someone past this is new, and am I really going to try this? The idea, the convenience, 24/7 from your home, especially in an environment where you're sick. You have the flu, you have pink eye. You don't want to drag yourself to ER or urgent care, and other people don't want to be around you when you have the flu or things like that can easily be taken care of with telemedicine. So once you get people at employer groups talking about using the service, how valuable it can be, especially I have 3 kids at home. My wife uses the service all the time because, moms just know. They know what's going on with their kids, ear infections, et cetera. And to be able to cut through all of the time taking off work to get services in person, telemedicine can really benefit there. I think this is the second one, clinical quality. That's been a big question mark. And as we, from a BSI perspective, got more and more into this market, that's a big thing for us, because if we put our stamp on, BSI stamp on any vendor or any service in general, we need to make sure that the quality that's being delivered is at par or better than anything that people would get certainly in person. Now, that never means to say that in-person care is ever going away and the value of in-person care. But as an addition to round out the services that are provided to an individual, you got to have doctors on the other end that know what they're doing, and can make sure that they're assessing situations. Obviously, if they get people that are in an ER situation, they want to be able to direct those people as soon as they possibly can. And then, when it goes the other direction, you want to have doctors there that are of the highest qualifications, and there's confidence there that they're delivering effective care via telemedicine. Last bullet here, no travel expenses, obviously. The idea that $125 is what's listed there. If you could see it, I don't know if I can move this here, but it can be a fraction of that and actually can be of zero cost if implemented correctly with employers. This is just a laundry list of some of the players in the telemedicine game. This is only going to increase, and this is only the third-party companies that are involved. In addition, no matter where you're at, most likely you have major health systems, Geisinger, St. Luke's, Lehigh Valley, some of the big ones around the Pennsylvania area. But anywhere, you're going to have the provider systems that are also going to have their own versions of telemedicine as they're slowly adopting. Certainly since COVID, they're adopting because they understand that they need to be in this space in telemedicine because it's the way of the future, and not essentially kind of sitting on their hands thinking it's going to go back to the old school version of all direct care. So it's important to the health systems to make sure that they continue to have people in their systems. We're going to focus a little bit here. Teladoc is the largest telemedicine firm in the country. It's primarily although we have a lot of different telemedicine organizations we deal with our clients, Teladoc is by far the largest. The majority of our clients that have telemedicine are platformed with Teladoc. And there's a very specific way that we do it that benefits employer groups, but also the employees. So this is just an example, you can see how telemedicine moves through. So obviously, member initiates, download the app right from the App Store. From a BSI perspective, we work with employers to incent their employees to go through this initial process. It takes 10, 15 minutes max to go through, download your app, and then set up your chart online. So if you think when you go into the doctor's office for the first time and you get that stack of papers to sign and list everything that's going on with you, the first time that you go on and download the app, you have the ability to then go in and fill out your chart. You also have the ability with most telemedicine providers to link your chart if you choose with your primary care physician. Because I think that's a really important part of the transition to telemedicine, is making sure that people's primary care physician are in the loop and have access to your records. So you have the ability to do that as well. Taking the time when you originally set up that application on your phone and going through and filling out all of the questionnaire online, that 10, 15 minutes spent there doing it You don't have to do that to access telemedicine at a future date, but if you think, to the first time that you actually use it, let's say your kid has 102 fever and you know that you need to get some antibiotics, telemedicine. If you have already completed a chart, potentially telemedicine, you could be on the phone with a doctor within 2 to 3 minutes. If you haven't set up telemedicine, you're still going to get there, but you still have to go through that process of 10 to 15 minutes of filling out that chart. So we always encourage people when it's peacetime, when you don't have a child screaming with a fever or you're not sick yourself, take the time to do that up front, and then it makes using telemedicine even easier. So as it progresses, you can go in through the telemedicine applications, you set your meetings. Obviously, you can either do it into the future if you're working with a primary care physician, or you could do it on demand when you're ready to obtain services. Of all the times that I've ever personally or my family has used telemedicine, we've never had to wait more than 5 to 10 minutes at max to be seen by a doctor. That can vary between the companies that you're using. Okay, so let me see if I can move this here. Just to give you a little bit of an idea here, this is pink eye, very, very common use of telemedicine, and certainly popular amongst kids to come home with this from school. But they'll give you an idea of the savings for an individual. So let's say that you have an emergency room copay through your insurance, it's $200, or you have an HSA, a health savings account, which means you have to pay the first 500, 1,000 or more of a deductible. You go into the ER to get pink eye treated, you're going to blow through that cost out of pocket as an individual. In contrast, there on the right-hand side, Teladoc, if it's set up appropriately, it's paid for by an employer, unlimited use from an employee perspective. That means that same visit, if you're calling in with pink eye, that's a $0 copay. And again, the phones keep getting better. The idea that you're calling a doctor, if your kid has pink eye, that doctor can potentially just ask you to put your camera on the phone. We'll analyze the situation to determine if they believe that it's pink eye, and on you move in the system to get a prescription to easily take care of pink eye. You also add in these other bullets here, travel time. So depending on where you're at, how long is it going to take you to get to the ER? Certainly in the last 3 days, good luck with the weather here, with the way it's been locally. But obviously Teladoc, you're not traveling at all. You're simply logging on through your phone and getting that appointment. And then obviously the wait time, think 30 to 60 minute wait time in an ER is pretty generous. I think everybody's probably been in situations that were longer than that. So again, 5 to 7 minutes is the average wait time with Teladoc. Some good stats here, just in general, with respect to improved diagnosis, improved treatment, avoidance of unnecessary surgeries. So there's a lot of benefits of telemedicine, and now that it's been around and it's being more and more heavily used, we're, from a BSI perspective, we're a big data analytics firm with respect to analyzing medical claims. We have our own actuarial department in-house at BSI, that's all that they do all day is look through claims. God bless them. It's not my job, but there are people in the world that love to do that. So we found them a home, certainly crunching numbers. But there's really good data and positive results that are coming out of telemedicine when it's implemented and educated properly. So you can see there 92% of concerns resolved in the first visit and 95% of medical adherence when diagnosed, kind of moving forward. So this is just a general list of all the things that are out there. Now, this has really progressed. It's sped up over the last couple of years as it's become much more popular. So we used to just be in this situation, general medicine, you have some of those things, pink eye, flu, whatever it is, you need an antibiotic. That's kind of been the basis of telemedicine kind of this entire time. Now we have these other bullets, and especially this one. So you see dermatology, net care, nutrition. These are growing. Dermatology, especially if you've ever tried to get a dermatology appointment, it can be a 6 month to a year wait to get in to see a dermatologist. That's how difficult it is in a lot of areas. But this one in particular has exploded. Like I said, mental health care, with the state of the country and with the pandemic and COVID, obviously there's a lot of impact on the mental health, with respect to really everybody, but the idea, I think, particular of, working moms that got kids at home and they're juggling, hybrid school and still trying to work full-time jobs. It's very stressful. And we see that across our client list in the tens of thousands of employees that we represent through their employers, big spikes in mental health needs over this time. And again, mental health done right through telemedicine costs zero for the individual user. So if anybody, if you've obviously ever spent any time in a therapist's office, that very typically is not covered by insurance, and it certainly can reach $75, $100, $125 a session or an hour, whereas mental health can be established on a one-on-one basis with licensed professionals at no cost if it's set up correctly. So really opening up mental health with telemedicine, opening up this much needed service during this time period, you know, in the world for people who traditionally weren't able to access that type of care. So on the other side, on the employer cost savings, and you know, Wilkes University, a client of ours, actively engaged in telemedicine as well. These are just some other examples to understand the financial impacts on the employer side. So here where I am, County of Northampton, is about 2,000 employees that we represent. You can see there by implementing Teladoc in 2017, almost half of all of the employees and members there have used telemedicine at least once. That has resulted in over $1 million in savings. Great ROI, you know, return on investment. There are a lot of things with respect to wellness and employer spend that are very difficult to actually track good ROI, but telemedicine done right is very trackable. When you use the Teladoc program, which is what we heavily promote, when you're done with a call, they'll actually ask you, if you didn't use telemedicine, what would you have done? Emergency room, urgent care, primary care physician, or nothing? And depending on what that answer is, they can assess a more accurate ROI. If you would have went to the ER, instead you use telemedicine, that most likely is a 4-digit savings because it costs $1,000 plus just to walk into an emergency room most of the time. Now, an employer may be paying that, not the employee, but that's where it's so valuable from an employer perspective, if you can get employees to engage in the telemedicine piece, and obviously more convenient for them. So these are just some examples. West Shore is one of the largest school districts in the state down in Harrisburg area, and then Hazleton, obviously much closer to Wilkes, very large school district. But all of these organizations, heavy utilization in their employee class, and then that translates to a significant amount of savings for the school. So I think kind of that net general summary, you know, here is that it's certainly, let me unshare here. There we go. Without question, it's not going away. It's going to continue to explode from a telemedicine perspective into the future. And I think that, you know, what we have prepared to do from a BSI perspective, we've been out ahead of this 4 or 5 years, really trying to not just implement telemedicine at employers for their employees, but more importantly, doing it the right way. So that's $0 cost to the employees, unlimited utilization, and then really educating and promoting, you know, moving forward. So, you know, I would certainly, you know, throw that out there to anyone, which is on the employer side, it's a win-win every day as long as it's done correctly. And then on the employee side, it's going to be becoming more and more valuable. And, you know, anybody that is not using telemedicine, I would bet that if you have insurance through an employer, most likely it is offered to you. And I think just making some inquiries either through your human resource department or certainly doing your own research online will kind of lead you to telemedicine. There may be, depending on how it's set up, a copay, but ultimately the takeaway is we're going to continue to move forward with telemedicine being more and more involved, as opposed to, you know, kind of moving away. So that at this point is my presentation. I'm not sure, Garf, I don't know if you're, you know, if you want to just, you know, maybe just jump in if you have anything to add. I mean, again, with your background and, you know, Garf, just as a lead in, a little bit different than BSI space, you know, we're in the middle representing telemedicine from an employer perspective, and Garf was really on the ground, you know, at the beginning at hospital systems when they went about kind of rolling it out that way. So Garf, I don't know if you want to give anything to add to that. Certainly, you should have been on my history slide on telemedicine.
Yeah, I feel like that's been a big part of my history, Tony. Very nice presentation. One thing I do want to emphasize, though, is in one of the earliest slides, it talked about emergencies. In the hospital setting, it really was emergencies that were the very first successful applications for telemedicine, specifically stroke, and neonatal challenges where, so if, as during my travels, I've probably physically walked into over 500 hospitals, and some of them are so rural. I mean, they literally have no staff to take care of things in the middle of the night. And if you can get a neurologist who can look at a patient and help you make a decision about stroke, the cost savings is phenomenal. I mean, a stroke patient, a stroke that goes untreated costs the healthcare system about 200 grand. And so the numbers are pretty impressive. And you're dead on with, again, in the hospital setting, telepsych is growing like crazy because patients who go into an emergency room in a hospital, they can't be discharged if they present as any risk to themselves or to anybody else. And the average wait time to get a psychiatrist to actually clear them right now is about 24 hours. But with telepsych, where they can bring in a doctor remotely, they've dropped that time down to less than an hour for the hospitals that do that. So those have been some of the earliest applications that really got it going. And it was before there was any reimbursement, before COVID. It was just that, wow, this is a way that we are actually improving care by using telemedicine. And of course, now it's expanded exponentially, and COVID has just put it on steroids. And it is now becoming mainstream, and it's pretty exciting. And again, your presentation had some wonderful metrics in there about how effective it really is for care, the quality of the outcomes, as well as for cost savings. Yeah. That's what I would add.
Yeah. Garth, do you agree that, from a provider system, obviously they've been embracing it a lot more, just knowing what you know in your background and working with them on the revenue side of things, do you think, kind of as a longer term, the successful health systems will be able to pivot, using a, popular word of the year, into more of a telemedicine and not, experience massive loss of revenue and, all the horror stories that maybe they prevented them from jumping in, years ago? I mean, do you think there's a path there for them?
Absolutely. Absolutely. No question. It's just too efficient. I mean, it is just too efficient, as you pointed out with some of your stats. And it's always a lot of folks have had a misconception that people don't like it. Again, when you don't have to get in the car and drive and wait and, maybe not have, and then get the average of, used to be 17 minutes with the doc, before he had to see his next case. It's just efficient for everybody. I mean, going back, I remember in 1993, I was it didn't even call it telemedicine. It was a communications meeting down in Washington. And I happened to be sitting at a table with a guy from the Office of Management and Budget, OMB. And he said, this whole thing is never going to take off because we're never going to be able to afford to have doctors sit at their homes or in their offices and see patients. And that's exactly what we're doing now.
Yeah, for sure. So, yeah, it's really interesting. But, Margaret, I don't know if you want to, we're jumping back on, but certainly appreciate, the opportunity to be able to chat a little bit.
Oh, the pleasure was ours. What a great presentation, Tony. And thank you so much, Garth. It's a challenge when we are looking at potential seminars and programs to put out to our alumni that we believe are really relevant in today's world. And, we've all had to do so many pivots in the way in which we operate. And this one is just fascinating to me. And I've become such a believer because, there are many people who are fearful of going to the doctors now, or going out and facing potential exposure. And this as an option is so beneficial for consumers that they don't have to take that risk on things that are commonplace ailments, but they need the security and the advice of a professional. So it's just absolutely so relevant in today's world. I am interested, Garth had mentioned that there's some perception of people not liking it. I'm sure you have statistics that really refute that, because once you get into the process of seeing a professional through telemedicine, and my experience has been that it's so simple, it's so efficient, it takes a fraction of the amount of time that I had invested previously in going to see someone. What kind of feedback have you seen, from consumers as it relates to their?
I'll give you an anecdote or a story to kind of explain, how popular it is. I mean, I think first you have to get people to be able to try it. And I think COVID has really kind of tipped the scales that way, where the idea of, am I willing to try this, or maybe I'm not sure, versus do I want to sit in a crowded emergency room with a mask with a bunch of other people who potentially not only are sick, that's a given, but are also carrying COVID. So I think once people get to try it, it's a very good word of mouth benefit, meaning the feedback is you really need to try this. It's easy. The way that I'll explain how popular it is and has become is that, we deal 50% of all the membership that we deal with is unionized populations that work for their employers. And Sean Hughes, our senior vice president, who's actually on, as well today. Sean and I were at a school district at a board meeting when our contract was on the agenda to come in as the new benefit consultant. And when they voted to bring us on board, Sean and I got stopped on the way out of the auditorium by the head of the teachers union. And basically what she said to Sean and I was, we'll get along just fine as long as you don't take telemedicine from us.
Oh,
so
there you go.
I'll tell it via a story, because if you can get the head of a teachers union anywhere to say we're on board, it's not the easiest relationship typically to manage in our space, because benefits are so expensive. So to have someone basically say, we'll be good with you as long as you don't take that benefit away from us, it's wildly popular. And like I said earlier in the presentation, it's popular, but it's a win-win, because the more people use, we call it a good spend for organizations. The more people that you engage as a company or organization, the more they utilize the benefit, it actually increases the amount of money that organizations save, because you're diverting care from other places that are inefficient and cost more.
I am, frankly, that doesn't surprise me at all. When telemedicine was an option here for us at Wilkes, it made all the difference in the world for so many of my colleagues. And I've heard so many positive things about it. And I have positive things, that I share personally. So I thank you for your role in bringing that to Wilkes University. And I thank you for your time here today. It's been fascinating. I want everyone to know that we have recorded and will archive this. It will become a part of our permanent collection that's available through the Alumni Association. So if there are things that you heard and you want to go back and take a look, please take advantage of that, as well as reaching out to us if you have a business that could use the expertise that Tony brings to the table. Even though he said he doesn't have such a good transcript, I think he's come along a bit. So I certainly would endorse his support of Wilkes University through the services he provides. And I want to thank all of you for participating, and encourage you to come back next week. We will be having our very own Dr. Bob Bolander presenting a seminar on mental health, very relevant in the telemedicine world, as well as all of our world. It's a request that we've had from quite a few people. So we look forward to having Bob come and present. He's on our faculty, has been for a long time. So we get the best here at our Wilkes Wednesday webinars. So thanks to all. Thank you, Tony. Thank you, Garth. Thank you, Sean, Mary, behind the scenes. And we look forward to seeing you again next week.
All right. Thanks so much, Margaret. Really appreciate it. Thanks, everybody.
Bye now.